Depression is a serious problem that affects millions of people every day. Overall, an estimated 17.3 million adults in the U.S. had at least one major depressive episode. This number represents 7.1% of all U.S. adults. Depression not only makes a person feel sad and dejected, it can also damage the brain permanently, so the person has difficulties remembering and concentrating once the disease is over. Even though there are several treatments for depression, not all of them work for every person. Depression is the leading cause of disability. It's a worldwide spread disease that negatively affects how people feel, the way they think, and how they act. Women are 70% more likely to experience depression than men. Hormones are partly to blame. It's estimated that more than 300 million people are affected by depression globally. Up to 20% of depression patients never make a full recovery. Good treatment for depression isn't cheap, and the cost varies greatly depending on several factors. Many mental health professionals practice outside of insurance networks. The out-of-pocket cost of treatment can be considerable, even prohibitive. Obviously, a longer course of treatment will lead to higher costs. The first choice for depression treatment is genuinely an antidepressant medication. Selective serotonin reuptake inhibitors are the most popular choice because they can be quite effective, and they can tend to have fewer side effects than some older antidepressants. Up to 50% of people diagnosed with major depression don't get better with their initial treatment. Doctors have even made a term for this called treatment-resistant depression. That refers to depression that doesn't improve after 6 weeks of treatment. If you are being treated for moderate to severe depression, a doctor has probably prescribed you an antidepressant medication for you. When they work properly, they can help to relieve some symptoms, along with other approaches such as talk therapy are an important part of treatment. One way antidepressants work is by altering the balance of certain chemicals in your brain. As with all medicines, this change can cause side effects. With the several side effects associated with synthetic drugs for treating depression, it's quite necessary to say seeking alternate methods of depression treatment will be more than adequate and wise for overcoming depression. 3 or more common methods used in depression treatment include cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. Often a blended approach is used. Studies have shown that cognitive therapy is as effective as antidepressant medications at treating depression, and it seems to reduce the risk of relapse even after its discontinuation. Feelings of isolation, anxiety, and other emotional or financial stresses are known to cause the risk for depression and suicide. People may be more likely to experience these feelings during a crisis like a pandemic. With the world dealing with the COVID-19 pandemic, it's more important than ever to seek affordable treatment for depression through medical, doctors, medication, and therapy.